Okay, so thanks everybody for coming to, I guess, the second last lecture of the year, and what should be my last. Kristen's going to be here next week. Not sure what she's going to talk about yet, but I'll talk her into it. And she'll give more of a student's perspective of Hempology 101, and I'm quite looking forward to that. Today I'm going to focus on Health Canada and the marijuana medical access regulations. It's hard to say it like that because it doesn't sound as clear as medical marijuana access regulations, but it's marijuana medical access regulations. And so I'm going to be talking a lot about court and how things have progressed with the regulations up until today. So when I started the Cannabis Buyers Club back in 1996, there were no provisions for medical marijuana. In fact, the Controlled Drugs and Substances Act hadn't been brought into effect yet. But we did have a Canadian Charter of Rights and Freedoms, and there had been a few court cases come in around the issue of medical necessity. Some did argue medical use in court cases across the country. And I understand in many cases charges were thrown out or charges were greatly diminished if a medical necessity argument was presented. And so while Jim Wakeford was the first individual to force what was or what is known as an Exemption 56 from the Controlled Drugs and Substances Act, the CDSA didn't come into effect until 1997. Before 97, we had the Narcotic Control Act and the Food and Drug Act. And under those two laws, or sets of laws, people argued medical necessity, and apparently in those cases, the Crown, for the most part, let the lower court decision stand, and it was never appealed or argued one way or another to a higher level of court. And so 97 came along, and the Controlled Drugs and Substances Act came into effect. And I guess he must have been busted right around the same time, but Jim Wakeford and another individual, I should know this, Parizeau, I think Jean-Jacques Parizeau. Anyway, two individuals were granted in court what was called an Exemption 56 from the CDSA for medical use of cannabis. And they essentially were able to argue that their medical need was, in essence, more important than the state's need to uphold the cannabis law to its full extent. And the courts, couldn't, or the Crown, or government couldn't argue that public safety was put at risk by letting certain individuals use medical marijuana. If they had, in Jim Wakeford's case, he was dying of AIDS. And so the Minister of Health at the time, Alan Rock, was given the power to grant an exemption to individuals who proved medical necessity. So very quickly, a number of people applied for this medical exemption. As I said, medical marijuana wasn't new before these laws or regulations came into effect. People might have been quiet about it for fear of the law and things that come with that. But a number of people applied, and these exemptions started to trickle out of Health Canada, but it was very discretionary. Alan Rock could pick and choose who got exemptions and how fast the exemptions were processed, and there were no set rules, really. It was just this open clause. And so that was challenged. Terry Parker, and I believe Professor Alan Young, a lawyer, was key in all of these decisions earlier on. Anyway, Alan Young, on behalf of Terry Parker, a person with epilepsy, argued that the regime, the Exemption 56 mechanism, and synthetic THC, Marinol, were not appropriate therapy, and that in fact they put his life at risk in a sense, in that the medical system had no effective treatment for his epilepsy, and his seizures were quite dramatic. And the contrast of using either synthetic THC or prescription drugs compared to smoking small amounts of herb was very dramatic. And his doctors were willing to testify on both less frequency of seizures and less of traumatic event in each one of the seizures cases. So it was very strong medical evidence that was presented in his case. And moreover, it was argued that the current system that was in place, that is the Exemption 56, was essentially illusionary in the same way that the abortion mechanism was illusionary when Henry Morgentaler was providing abortions. Just give a brief history of the Morgentaler decision, because it's critical in the MMAR and our ongoing fight with it. Because when Henry Morgentaler was arrested in the early 80s for providing abortions, there were mechanisms in place for women to have that procedure. However, the time constraints, the bureaucracy, just the process that women were forced to go through to have access to an abortion was so cumbersome, time-consuming, intrusive, that it was in essence illusionary for most women. They just didn't have access to it. It wasn't feasible for them for all sorts of different reasons. And so Henry Morgentaler just opened up a medical clinic and said, well, I'll help them out if no one else will. And so he argued that he had a civic duty as a healthcare provider to go and provide these services to vulnerable citizens when the current system was in fact illusionary to them, is the term used in court, but inadequate or dysfunctional would be other appropriate terms. And so the Parker decision, which was upheld by the Ontario Court of Appeal, didn't go further. None of the decisions I'm going to talk about went to the Supreme Court of Canada, because every time our government argues against medical users, they've been losing, and they get to a Court of Appeal decision and they stop because the Supreme Court of Canada could strike down the cannabis law for everyone even, or otherwise really affect law much more than these lower court decisions have. And so, the Ontario Court of Appeal decided that cannabis needed to be made medically available, in essence, to people that had what they defined as chronic pain. And so, personally, I was really pleased with the Parker decision in a lot of ways, in that it reaffirmed our club's mandate, which is essentially people that have permanent physical disabilities and diseases. And so Health Canada's program is essentially made to help people that have either chronic pain or otherwise by recommendation from a doctor, is how it's been phrased and how it works. And again, that is in essence the same mandate as our club. However, the medical marijuana access regulations that came out in, I guess it was July 2001, have certainly been more restrictive than our club's mandate, because they require a doctor to actually recommend it. And I have a copy of the forms here. There's been a lot of criticism and changes over the almost 10 years now that we've been under this program. So it's kind of hard to generalize about, because it's changed. It was a lot longer than this. You can see there's lots of different forms that you can fill out here. Fair amount of information, but it is something where people not only have the ability, if their doctor recommends it, to possess cannabis, but to grow it themselves, or also to sign up what is called a designated grower. And so the forms here, it's been criticized. I think there's 35 pages now, and some people aren't happy with this size. But honestly, if you just want to get a simple license to possess, aside from some forms of information, you really have got 4 pages plus the well, I guess 8 pages, 4 pages for you and 4 pages for your doctor to read and fill out. And it's actually in fairly simple language. The problem, though, is not the length of the forms. The problem is getting doctors to cooperate and sign the forms. And so the problems, I guess, go in 2 directions since the formation of the MMAR. And one is access to the system, and the other is supply. I'll start with the access issues. It is very hard for people to get into this program. There are about 1 million Canadians that would be technically considered to be in chronic pain right now, and approximately another 3 million Canadians that are being diagnosed various kinds of prescription drugs from a doctor for sleeping, for anxiety issues, for different kinds of eating issues, and that's both ways, people that don't eat enough or people that eat too much. To say there's 3 million people really is talking about those that are being regularly prescribed drugs, not people that have these issues once in a while. Of the 30 million Canadians, certainly due to stress or injury or otherwise, there's a lot of more people than 4 million that use various kinds of prescription drugs. But there would be about 4 million Canadians that are on an ongoing basis using prescribed drugs right now. There are, and the last statistics Health Canada's kicked out are still January of last year, but there are only, as of last year again, 4,884 patients with a license to possess. So 5,000 patients out of 1 million in chronic pain. So that's 0.5% have gained access to this program. And there are a few reasons for that. The main reason is doctors are reluctant to sign the forms because of liability issues and uncertainty in regards to the medical application of cannabis. Now, the liability issues were brought up by the insurance company that insures the various doctors. I forget the exact name now, but several years ago, a letter was issued by this insurance company that the doctors needed to be very concerned about any liability that would result from the cannabis being used and any negative impacts that come from that. The doctors would end up having to be responsible for it. And so that sent a chill through the medical community. And I believe in that pile there, I have a form that's a waiver that patients can sign, that they give a copy to their doctor that waives the doctor of any responsibility for their use of cannabis. But regardless, a lot of physicians have ignored that and just said, no, my insurance company won't protect me if I write these sorts of things. And that has been their justification. There's a really weird situation in terms of cannabis being, in some sense, authorized by the courts, but not an approved drug. That is, there's a long regulatory process that drugs need to go through to become technically approved. There's a drug approval process, is what it's called. It costs a lot of money to go through all the different double-blind tests and this and that, and many years. Now, I didn't talk about prairie plant systems, but when Allen Rock was first told that they needed to allow for the medical use of cannabis, they put aside money to pay a company. Eventually, Prairie Plant Systems got the contract to produce cannabis that was initially to be used for research and research only. And that has been completely stalled because while there were a few both chronic pain and AIDS studies that started a few years ago, I believe 2006 even, the conservatives cut funding to research, and so the only research being done now is apparently being done to prove that the use of cannabis in young people can cause schizophrenia. But there are no studies on any medical benefits. There are no studies even from within Health Canada or questionnaires even sent out from people that get their pot. But since 2003 in the Hitzig decision from in Toronto, the Toronto Compassion Club got arrested and 7 people filed a lawsuit that the 2 court actions got put together and become known as the Hitzig decision because they told the government that the initial regulations were problematic in a number of different areas. So in 2003, a number of changes did occur, and one of them was that access to Health Canada's pot with prairie plant systems had to be opened up. Before that, patients were literally forced to grow their own, or they had no other source. And so the prairie plant systems pot has been made available to people since 2003. But to my knowledge, there's been no studies done on it, no clinical trials. Prairie plant systems is not intent upon passing cannabis through the drug approval process. That's not their goal at all. Their goal, along with other pharmaceutical companies, is to make extracts, pills, inhalers, things that they can patent and own and control and stop people from using the raw whole plant. I firmly believe that everything within the regulations and within Health Canada itself is bent upon stopping people from using plant-based medicines and forcing them to use prescription drugs to the detriment of our health and the benefit of Fortune 500 companies. And so this is a perfect example because Prairie Plant Systems has actually been given the patent for growing cannabis. Along with the contract to produce it for research, part of the drug identification number process, because every time somebody tries to present something as a drug to be approved, they've got to get a DIN number, right? So to get your DIN number, you have to write out what the process entails in the production of that drug. For normal synthetics, there's this whole chemistry thing that they write down in their formulas and cook it at this temperature, blah, blah, blah. But for cannabis, it's not that at all. Let's just stick the seed in the ground, you put some water on it, put it under a light, pray, and you get some pot in a few months. Not quite, but Prairie Plant Systems has submitted this standard operating procedure for making the cannabis plant grow. They own that, which is why Health Canada cannot provide any assistance to patients trying to grow their own pot. They can't authorize anything without the express permission from Prairie Plant Systems, because Prairie Plant Systems owns the process by which to grow medicinal cannabis in this country. And so they have no intent, though, upon following through upon that. And so we have this really awkward situation where cannabis is not an approved drug. Cannabis is an authorized drug. That's what these forms are. They give you the authorization to possess it, but you do not have a drug that has been approved in any true sense. And in fact, there's no direction in this country towards doing that. And so, gee, I could go on forever. Because a lot of this leads into our trial. It's quite pertinent to that, but I should build up towards that. So there's some access issues to be sure. I just want to finish on that. I'm getting into supply, but a lot of patients are having trouble getting their doctors to sign because, again, it's not an approved drug. The doctors cannot refer to their CPS and look up any counterindications that it may have with other prescription drugs. And there's very few of that, right? Like, as far as I know, the only other sort of medications that cannabis can have effects with that are not good would be heart medications and some mental health issues, severe forms of schizophrenia, if you would use that loose term. But for people with severe mental health issues that are using heavy drugs, sometimes the drugs can work quite well to calm them down and help them be more functional. But if you throw in a joint with that, it might not be beneficial. Aside from those situations, which are quite rare, really, Cannabis doesn't have, interaction with other drugs that are negative for the most part. Quite often, cannabis complements the use of other drugs. So with opiates and stuff, people can often take significantly less than they were before, and not necessarily cut the prescription drugs entirely, but cannabis seems to really complement or help other drugs be used through the body. Anyway, so access to the program is a problem. However, access seems to be getting better in some ways, although most doctors in the country are quite reluctant to sign. There are more doctors here opening up to the idea of signing forms, and in particular, there's a few that are putting themselves out there to the point now where there's, I think, at least 3 clinics that at least claim to have physicians on call. There's businesses as well that are using things like Skype to have a physician confirm, essentially, over the phone almost, that the patient has the proper medical documentation that they need to sign up. So these doctors, that they don't actually diagnose. They confirm that another doctor has made the diagnosis. Or in the case of B2, there's sort of 2 categories within the program. There's B1, which lists about 7 different severe medical problems, and if you have one of those, you just need your doctor to fill out the form, and without talking to anyone else, it gets sent away. With B2, if it doesn't fit within B1, you would need to have your doctor consulting a specialist, or and so I'm not sure how each of these physicians work the consultant part, but I understand there are more and more businesses that are opening up that have access to these physicians. Here on the island, we have Dr. Gooch, and I'm seriously considering even hiring Dr. Gooch to come down to our club once in a while and just sign up as many of our members as possible. It's something that, while it might not be easy for most Canadians to get access to this program through the internet, it might be that with some retired doctors willing to sign forms, people start getting access to this, even though it is cumbersome. Supply, though, is an entirely other matter. There are a number of supply issues, starting with prairie plant systems. Right? A lot of people can't grow their own medicine, and so they rely upon others to do that. Now, not everyone knows someone who might be a designated grower. A lot of people that use medical marijuana in this day and age don't come from the drug culture. A lot of people that use medical marijuana right now would have started to get it from one of their kids, or someone else that they know, and they would have gotten to try it out. Certainly a portion of people that use medical marijuana, like Gail, would have been doing it since they were teenagers. But a lot of people don't have either the resources or knowledge or connections to grow their own. And so they rely upon the government if they don't have a sort of dispensary like ours to go to. Now, Prairie Plant Systems has had a lot of criticism about their cannabis. They just grow one strain. They started out growing, I forget how many, I think it might have been close to 200, but they got a whole bunch of seeds from the RCMP. You'd think they would have just got them from Mark Emery, because that's where they told other people to go afterwards. But anyway, they used their own parameters to pick a strain that, according to their stats, has between, I think, 8 to 12% THC, but most people would think it would be closer to 8 than 12. And earlier on, I think it was closer to 5%. And for a lot of people that use cannabis, that's from the green market, you could say, that's a very low percent. I think the leaf that we use for our cookies might contain 5%, but most people would be used to like more like 15 to 18% for medical grade. So very low THC percentage. On the other hand, it was very harsh. It was ground up and dried, irradiated. Sorry. They want to kill all the fungus and mold and everything like that on it. So it really, from my understanding, tastes quite poor when you smoke it. certainly compared to the medicine that most people would smoke, and even compared to, say, tobacco or anything like that. Not that it wouldn't burn, it was relatively clean burning, but the potency has gone up due to the numerous complaints over the years. And it's my understanding that there finally might be a second strain coming out of Health Canada, Prairie Plant Systems, which would support a lot of arguments from people in the medical marijuana field who've said that and proven that indicas and sativas have quite different effects. And my understanding is the strain from Health Canada has been more sativa dominant than indica, and indica is more of a pain reliever, the body stone that many people are looking for. And so that's partly why many people haven't found any or little medical benefit in what Health Canada has to offer. We have 3 minutes left. There are a lot of significant problems with Health Canada's regulations. I obviously could go on. I guess the supply issue, though, to tie it into our court case and in some sense wrap up the year, is that Health Canada has allowed people to grow their own cannabis or have other people grow it for them. And in the regulations, it's referred to as dried marijuana. However, while it's not spelled out in the regulations, if a person was to make an extract, say one of a number of different kinds, taking dried bud and putting it over a screen and simply shaking that screen until the hash falls through the screen. According to the law, that resin that would fall through the screen would be illegal to possess for a person with a Health Canada license. Likewise, if you were to cook it into a butter or an oil, and instead of using a screen, extract it with a cheesecloth, you would have produced a controlled drug, which in the laboratory could be identified as either cannabis resin or as THC, or actually as containing CBD, CBN, which are two other cannabinoids that are listed in the Controlled Drugs and Substances Act, separately from cannabis resin, separately from cannabis marijuana. If you look it up, there's like 5 different distinct drugs that the cannabis plant contains in its natural form. Or I guess one of them is the plant, and then there's resin, and then the other 3 cannabinoids. There's never been justification from Health Canada as to why that is so. Our reasoning is that it protects drug companies because they sell synthetic THC, $8 a pill. And there are some drug companies making a fair amount of money from that. They want to protect their interests, to be sure. But the idea that naturally occurring THC would be unavailable for people to make in their homes from a plant that they legally grew in the first place is absurd. And one that we and many others are going to challenge. Our bakery got raided about 1.5 years ago. My friend Owen Smith has been charged with trafficking in THC for making food and skin products. And we are very much going to argue the regulations are inadequate and that they need to include cannabis resin, CBD, CBN, and THC, and that people should be allowed to, if not encouraged, to make their own extracts as an alternative to smoking. In fact, there's people in Ontario working on this, and there may even be things happening this week where Health Canada might finally be acknowledging the need for people to use extracts and to make that legally available. A lot of people have argued the use of hashish allows for them to avoid all of the tars and other harsh properties that can appear in the plant, and people would use much less plant material if they could smoke hash, and it would be healthier, they'd have a better effect. Obviously, though, they need a lot more plants to produce the hash that they would need. Other arguments for edible and topical products as well have suggested that the daily allowance that people have should be much greater. And there's various reasons for that. I unfortunately don't have time to get into because my life is going very quickly. So I'd just like to thank you all for coming. I guess next week is the last semester, but this is my last this year. So I'd just like to thank everybody for all the support and coming up. Have a great day.